Hello and welcome. I'm Michelle Spencer. I'm a licensed massage therapist and I'm here to give you an introduction to the world of massage. There are a few things that are beneficial to understand while receiving massage that can also be applied to self-care and time outside of the massage session. I'll try to explain some of those things that I think are highlights. First, I'd like to give a brief of my history, why I feel confident in what I say in practice. I grew up with a mother who was injured. She had lots of surgeries, more than 40 by now. And so I was constantly going with her to physical therapy, nursing, pre and post op appointments, and I was touching her damaged tissue at home. I was helping her do her exercises for physical therapy. I was helping clean and tend to the wounds and the related structures, so the muscle around the area. I was helping maintain the health of that tissue. I was helping her wear away at the scar tissue as well. So I've been through and experienced all the stages of recovery and injury many times. So that is a brief on my exposure to massage and bodywork. I have been a professional massage therapist for 4 years and some months. So that's how long I've been in the field working at spas and clinics. First, I'd like to go over some things that someone could do to take care of themselves to enhance the effects and efforts of massage, whether done by someone else, a massage therapist, or a family member or a friend. That's perfectly fine too, applicable. Or self-massage, self-care. It's important to be well hydrated. So, and by hydrating and drinking, I don't mean alcohol. Sorry, guys. For every glass of alcohol you have, if you're receiving bodywork, you should have 2 glasses of water. It's really important. The water is lubrication for your body. So when the massage therapist is working at the muscle, having water is important to allow them to have that freedom of movement, so it's like when they have to have lubrication, the lotion or oil. If you don't, it's really chafing. Well, water is that lubrication on the inside of the body. And so if you don't have enough water, then it is chafing, it creates more friction, and it actually damages the tissue a lot harder. Because massage is technically damaging tissue. Just like when you work out, you create micro tears in the muscle that encourages muscle to regrow, to strengthen, to rebuild. It encourages blood flow. Anyway, I'm getting ahead of myself. So, be well hydrated. That's important. No alcohol, no painkillers. That is ideal. Painkillers are a big issue because that affects blood flow. So like ibuprofen, that will increase swelling. It will encourage blood to stay in an area that will, where it pools. And then other things like naproxen, over-the-counter stuff, Tylenol, it does dull your sense of pain, and so you could potentially injure yourself. We don't want that. We're trying to help your body. So, no pain meds, no alcohol, ideally. Be relatively clean. So, a lot of people mention to me, oh, I don't know how you can work on people with their stinky feet, or like, what do you do with all these unclean people? Yeah, you occasionally get that one bad person who has not showered in 5 days and they have sweat and caked on skin. Try not to do that, please. And I'm not saying you have to be freshly showered. I know you get oil on you, you want to go home and take a bath, clean yourself off. Just don't have caked on skin. Don't be super sweaty from work. be generally clean. Hygiene is good. Um, a good thing to do before you go into session and after session, whether it's self-massage or actually going to see someone, is to do some gentle stretching before and after. So by gentle stretching, most of you who are probably my age or older learned to stretch by going until you feel a stretch, and then when the stretch goes away, go into it further. Don't do that. Instead, try going into that stretch, feeling the stretch, letting the stretch fade. This will take a minute or two depending, and just leaving it there. The idea behind this, and I don't know if I was taught this by anyone, I don't have any recollection, but the idea behind this is we want our bodies to become familiar with that range of motion. We want them to be comfortable in that state. So by constantly being in a state of stretch, your body is fighting that. It's constantly receiving the information that, oh, this isn't where it's supposed to be. And so even if you get a good stretch in, afterward, it wants to put it back the way it was. If we let it relax in that originally stretched position and feel comfortable with that position in the end, then we can gradually retrain the body. And that's what massage is about. It's retraining the body. It allows us to retrain it to think, oh, this is okay. And this can be a new normal. Or an old normal, depending on if you're trying to get range of motion back. Anyway. Another thing that is good for you to do to enhance effects and efforts of massage, as well as take care of yourself before and after, are baths. A lot of guys think baths are girly, or people just don't have the time. Some people don't even have a bath. Try to take an effort. Oh, it depends on the body, but I would say probably every other week get a bath in. Really, every week a bath, a soak is really good. Not only does it help warm the muscle and keep the body limber, but it encourages blood flow throughout the whole body. Something you can do also is put salts into the bath water. Salts draw out toxins, and you may have heard about massage releasing toxins into the body, and it's all mysterious and all this, but by toxins we mean like, oh, say alcohol. It's why you don't drink before going into massage. We kick it back into the bloodstream. I've had people go drinking the night before, be totally sober when they get on the table. They get off drunk. Don't drink. Anyway, so that's a toxin that we kick into the body through massage. Lactic acid. I'm spacing. It's another acid. Not folic acid. Wow. Anyway, it's the acid that causes gout. Other acids that the body produces that can cause, that can get built up, those get eliminated when we do a massage. So the salts, Epsom salts, when used in a bath, actually draw those out. So that's very good. It also helps reduce swelling. So if you have swelling of the ankles or feet, diabetes, it's a very good thing to do. Let's see. And in case you are here watching this and you are new to massage entirely, I'll go ahead and go over some things that happen in a regular massage session. So some things that people might be a little bit anxious about, I've heard. Draping. So draping is how a massage therapist will maneuver around a body that's on the table. And that centers around uncovering parts of the body primarily. Draping is what we call it. It's how we fold and tuck the sheets and blankets or towels around the body to make sure that the client is entirely modest and that nothing is exposed. In America, and with my training, a massage therapist is supposed to uncover only the part of the body that they are working on at the time. So, for instance, I am working on your back. Here are your shoulders, arms, torso, hips. I will take it to your hips, I will tuck it in under your pelvis, and that will be that. When I am done with the back, I will recover the back, and then I'll move to a single leg, where I will drape it around the hip line, and yes, some of your butt does get touched, but that's important. I'll get to that later. And so we make sure that everything is very secure. We make sure that nothing gets exposed. We take classes on this. It's important to us. So feel entirely safe. And some people still don't like that, and they wear their underwear. Perfectly fine. It's all up to you. It's important for you to maintain your comfort level. And any therapist who doesn't accommodate to you is, in my opinion, not a therapist you want to see. Moving on. Something that just happens in massage is exfoliation. Don't feel bad about it. I have some people get off of my table and they feel so ashamed because their skin just pellets off. Like, I'm applying friction with lotion, it's hydrating your skin, and it's sloughing off the old stuff. It's healthy for you. I'm not grossed out by it. It's natural. I clean up afterward. It's good. Don't think that that's something to be ashamed of or weird. Communication is absolutely necessary in a session. Be entirely honest. I get a lot of people who say, oh yeah, I was going to say something, but I didn't want to hurt your feelings, or I didn't want you to take it the wrong way. If you don't say anything, we aren't going to know. So if we're going too hard, if you're sensitive in an area, we can pick up on some nonverbal cues, like flinching or tightening of muscle, or like if your foot is moving, if we're working in your upper half. We can pick up on some of this stuff like that, but there are some people who are really good at relaxing into pain. That's not really a good thing, and so we need to be able to know when your limits have been crossed, because we need to make sure that the body is being taken care of and not getting injured. We're trying to help it, not hurt it. I think I said that before. It's important. Remember it. Okay, so moving on to primary parts of the anatomy that I deal with, and we're going to cover some things that maybe should have been covered before, but I put it in here in my outline for some reason. So I work with the skin, first and foremost. It's the first thing I touch. There are a lot of skin problems that people have that cause them to be self-conscious, and that shouldn't be. So we work with psoriasis. Psoriasis is really dry, scaly skin that can cause deep cracks. As long as the psoriasis is not an open wound, so the skin hasn't calloused and cracked open and there's fresh flesh there, then we can work on it, and it's perfectly fine, perfectly safe, no risk of contamination, anything. So we work with that. Acne, perfectly fine. The only thing is it cannot be ready to burst. So like white caps and things like that. We will avoid those because that's a contamination issue. If it bursts and we're smearing it around, that's bacteria. We're just smudging all over you and us. That's not okay. But as long as it's relatively maintained, don't worry about it. Most people have acne. It's life. It's your skin. It happens. Hair is another thing that people are really self-conscious about. Don't worry about it. There are ways to work around having a lot of hair. Usually it just means add more lotion or oil. Oil is better for hair. This is something I picked up from school. Oil is best for hair because it slides better. If you use lotion, it'll clump and tangle. It's best if a facility has both like a cream or an oil. They work pretty similarly. And then lotion. I personally prefer to use lotion. It absorbs better and creates more of a sticky glide instead of a really smooth glide. It lets me get more traction, which helps me get into deeper tissues. Moving on. So, along with the theme of embarrassing things, I think this is where I was going with it. A few other things that people are self-conscious about, I'll bring up here. So, body weight is huge. No pun intended. So, people have come to me a lot that, oh yeah, I was always thinking about getting a massage, but I don't want to make you touch fat. I've just got so much of this, and that's totally gross to you, right? No. So, there's a man that I worked on, and he was probably 400 pounds, very tall and very big, just all around. And he received gentle massage, and it helped him tremendously because he didn't get good circulation, and everything was so sensitive because all of this weight was on him all the time that it relieved him so much and improved his quality of life drastically. It is not at all a problem, no matter your weight. As long as you maintain your hygiene, it's our pleasure to improve your quality of life. Everyone can benefit from massage. Truly mean that, and I encourage you to do so. Yeah, benefit from massage. Farts. Yes, people fart. Girls fart too. I fart in session sometimes, and it's super embarrassing. Oh man. Stories, but I won't tell them. Don't hold in a fart. Please do not hold in a fart. I mean, it would be nice if you could get it out before entering the room because it's an enclosed space. But the thing is, when you hold in that gas, you are contracting more than you think. You are not allowing your body to relax. You aren't able to receive the benefit from the massage. You are gimping yourself. You are hindering the work of the therapist. You're not getting your money's worth. Let it out, please. And if you want to give a warning, say, hey, you may not want to have your face there. That's cool. We would appreciate it. And another embarrassing thing in that nether region. For you males, yes, boners. They happen. Honestly, I don't notice them. The therapist just is trained to look at the musculature that they're working on. We're very focused. And even if we do notice it, we know it happens. It's a body function. As long as you're not being creepy, as long as you're not trying to be provocative, as long as you're not like grinding into the table, as long as you're not playing with yourself, being blatant about, as long as you're not a creep, okay? We're good. We're good. No need to be embarrassed. That's come up a few times, and honestly, because when we work on the front of the legs, we bunch up the blanket and the sheet in the groin area anyway, we can't tell. And if it's blatant, then oh well, we move on. And speaking of moving on, the next area of the body, or next part of the anatomy that I'd like to talk about, is something called fascia. Fascia is this amazing stuff that fills our body. So the best way I describe this is fascia is like a body stocking. It is kind of a thin mesh. It's cross fiber, so it is a mesh, and it surrounds everything in our body. It's like a spider web. So I say that because it's sticky and it stretches, and more research is being done on fascia. It used to be taught that fascia is thixotropic, or it is kind of like candle wax. When you apply heat, it becomes malleable, and when you apply cold, it becomes more firm and brittle. Recent study apparently shows that it's not like that. I'm not sure. We will see. But fascia surrounds individual cells, it surrounds fiber bundles, it surrounds muscles. It is sticky, and so you know how as you age your skin becomes more lax? That's because the elastin in the fascia, that's one of the major components of fascia, elastin or elastic. Makes it springy, snap back, conform. Starts to deteriorate and does not regenerate. And so the stuff that makes your skin snap back and makes your skin stay here instead of, down to your feet or down to your wrist, that is the fascia supporting that. And so with this system, it's like your skin. Actually, fascia was most recently named the largest organ of the body because it is like the skin. It is a system, and it fills the body. It surrounds everything, keeps it in place, and not only that, but because it surrounds everything and it's a mesh, if it gets tight in one area, it affects everything surrounding it, and then adjacent things to that. It is an incredibly complex system, and we're learning more about it. I love fascia. I'll stop there because I could go on. If you want to know more, I can do a video on fascia. So I deal with fascia. This is a really important part of the body, and I interact with it directly. Muscle. You all know what muscle is. It's this stuff. Muscle has fibers. It goes it goes in specific directions. We therapists take anatomy courses in school to learn the names of muscles, but primarily know what direction muscles go and where they start, where they stop, and where they cross the joints, what actions those muscles make those limbs do. That helps us interpret these areas of tension in the body and try to read into what might be causing the body to have this particular pattern of tension or tightness, and what other structures might be related to those actions. If that's too complicated, don't worry about it. I tried, but it's not really that important yet. So we deal with muscle. The muscle, take the bicep, goes up in here and goes down here. So the direction of the muscle fiber goes this way. So in massage, we can go cross fiber. That's really abrasive. It's like taking a straw and bending it in half. It will not break, but you could poke a hole in it. It's more abrasive. And then there is going this direction. There are two directions, technically, going from here to here or here to here. The direction of the muscle starts out in one place. In the case of the bicep, starts off up by the shoulder, and then it grows down your arm. Each muscle has a specific direction. It's called orient and insertion, or origin and insertion. If you go the opposite direction of the against the grain of muscle growth, it's kind of like going with quills of a porcupine and against quills of a porcupine. If you go against it, you will get into the quills. You'll go deeper. It is a much more abrasive technique. It allows you to go deeper quicker. You need to be careful doing that because it can be damaging. Generally, it won't be that involved. When I do tutorials, I'll be sure to tell you these things. But most of the time, people do lifting and grabbing, and it's a lot more generic, not so directed, which is fine. Just means you don't have to worry about that kind of stuff. With muscle, muscle has, so there are the fibers, they have direction, but then fibers of muscle also kind of look like this. When a muscle is relaxed, it'll look like this. These are parts of the cell, a single cell of muscle. And when it contracts, it does this. What can happen is a muscle fiber can stay contracted. And that's not good, because then we can't contract it any more than this. So what massage does is it forces this open. That's what relaxing the muscle is. So another area of anatomy that I deal with is tendon. Part of the muscle, but we have to treat it a little differently. It is connective tissue, and the way the muscle is formed, that fascia that surrounds these bundles of cell fibers or muscle fibers, and then those clusters of muscle fibers, and then the entire muscle. The muscle fibers start to thin, the cells of the muscle itself start to thin, and what we have left is this fascia. As it tapers, it just becomes fascia. And so we have this dense connective tissue, and that is the tendon. And that is surrounded by fascia, and it actually inserts into the bone. The bone is covered with, you can call it fascia, but the fascial membrane covering the muscle and tendon in the muscle and tendon goes into the fascia of the bone. It is one thing. There is no separation. What can happen, this is what shin splints are, is if the muscle gets too tight or if the muscle doesn't grow as fast as the bone, then the fascia on top of the bone, also called the periosteum, can lift off of the bone because the muscle is pulling it. And that is what you feel when you have shin splints. It's incredibly painful. You are literally ripping off of the bone. Massage can help lengthen the muscle fiber, but sometimes it's a matter of the body just growing at different rates, and sometimes that can't be entirely helped. This is going into bone and joint. Joints have that kind of dense connective tissue around, particularly in the knees. It's called a joint capsule, and it has this dense connective tissue surrounding the space in between that makes the articulated joint and holds the fluid. Going back to water and staying hydrated, water contributes to the fluid inside of your joints. Lubrication, it keeps your body well oiled. And then ligaments are similar to tendons, only they don't connect to muscle. They're just connected to bone. So similar to what I said about the dense connective tissue going into the connective tissue surrounding the bone, it is the exact same thing, only it is meant to support different parts of the body, areas that hold a lot of weight. So like the low back, pelvis, the neck. Your head's heavier than you think. Blood. I work pretty directly with blood and lymph systems. The blood is, well, the cardiovascular system is pretty important because with massage, we do want to follow the muscle fiber, but we have to make sure that our broader strokes and heavier pressure always pushes blood toward the heart. Reason being is we have veins that have valves that are single direction. We have to push the blood through the valve the proper way, otherwise, if we try to force it the opposite direction, it will burst the valve, and that is bursting a blood vessel. That's not okay. That's causing injury. We don't want that. Lymph is pretty important. It's not really talked about that much, I find, at least in external sources for massage education. Lymph is the extracellular space that has, so it's called interstitial space. It's the space between cells and blood vessels. It's all the space that is outside of everything else. So outside of organs, outside of blood vessels, outside of capsules, outside of cells. It's, again, lubrication. That helps carry waste, cellular waste, around the body. There are valves that help direct the flow. The only pump for the lymph system is movement. So if you're sedentary, if you sit at work all day, if you're a gamer and you sit at your computer all day, if you stand all day and you're on your feet motionless, like a greeter at Walmart or something. You are not moving. Your lymph, your cellular debris is not moving. It is staying stagnant in your body. Massage is a huge, huge help with this. We manually move everything in your body. Going back to hydration, you need to replenish the fluid in between, replenish the fluid that we're pushing through the body, through the lymph system. By the way, that goes to your lymph nodes, which then siphons everything through to your kidneys, and then through urine. And that's how it eliminates. Now, with pushing things through the body, that has implication for medicine, illness, intoxicants. Remember that alcohol that we mentioned earlier? Yeah, this could be a major blow to your liver if you come in drunk, because we're pushing all of that alcohol straight through your liver. That's not good. Again, don't drink. Illness. Don't get on a massage table if you're sick or if you feel like you're coming down with something. For better or for worse, it pushes that illness through the body. It progresses it, whatever stage it's in. If you are recovering from an illness, that's good. But you know how you get all that junk all at once and you either have to blow it out your nose or you eliminate through your bowels? It makes it happen all at once. So be prepared for that if you're recovering from something and you get on a massage table. If you are getting something, that means you're contagious. You can spread it to your therapist, friend, spouse, whoever's working on you. And it will make you sick very fast. It spreads the illness, it spreads the bacteria, virus, whatever have you, through your body. This has a lot of implication for cancer. We have specific rules for people with cancer. They have to be terminal. If they want to receive massage and are on chemotherapy, or even if they aren't, to receive regular massage, and that's if they're like, I'm terminal, I just want a quality of life for my last days. We can do that. We have to have a doctor's note. If someone is receiving chemotherapy, because we push things through the body, we push that medication through the body. And if someone just received chemotherapy, the chemotherapy irradiates the body and kills cells. It has to stay in the body for it to do that. If we push that medication out the body, eliminate it from the body, then we're not letting it do its job. And that's a wasted treatment. We cannot perform massage on people who are receiving chemotherapy. At least we can if we receive a doctor's note saying after a week of chemotherapy treatment or after a chemotherapy treatment, then you may massage or that person may receive massage. That's fine, but it's something that the doctor definitely has to closely monitor. Where am I? Lymph, right. That's all of the primary parts of the anatomy that I deal with, that I can think of to expound on. So what does an area of the body that needs attention feel like as I'm working on someone? I'm just going to go over major problem sorry, I'm failing at words. I guess major problems that I can think of and try to explain them a little bit better. people ask me, oh, can you tell that I'm sore there? Or can you tell that that's tight? Absolutely. So the first thing I'm going to go over is muscular tension. So that's where those fibers of muscle are locked up and they're tight. A muscle should feel soft when it's at rest. If you can't poke your arm and it squish, then you need some help. What can happen is calcium is actually used by our muscle to contract. And so if someone is regularly using their muscle and has to be ready to use their muscle, calcium can be left over in the muscle tissue. And so that can actually keep the muscle in a contracted state. And I was going to say more about that. That's usually general muscle tension. And that is pretty easy to take care of. Generally just gently forcing it apart, stretching it takes care of that, and then it kicks out the calcium and any acids that have accumulated and whisks it away. Fascial tension is a little bit different and is actually pretty common. Fascial tension is where the fascia becomes stiff or constricted even around a particular area of the body, and that can cause pinching of nerves, that can cause poor circulation, that can be a major contributor to pain. That usually feels like you are trying to massage a cold slab of meat. If you have ever gotten a nice roast from the butcher and you see that nice thick layer of white stuff, that's fascia. And if you have ever tried to massage a roast before cooking it to help improve the tenderness, and you feel how tough and how ungiving that white stuff is, that fascia is, that's what fascial tightness is. And you typically feel that in the low back. You feel that on the sides of the thigh. Those are the IT bands. And you feel that sometimes in the thighs. You can also feel that in the chest. And that does not go away in a single session. Most things don't go away in a single session. But it's something that you can do home stretching and self-massage for. Foam rollers, if you have heard of those are a great tool. There are knots that people, going on to a different subject, knots are things that people often refer to areas of tension in their body. There are muscular knots and fascial knots. Muscular knot is where there could be a old injury in the muscle. Say you are pumping iron and you pull your muscle. So when you work out or use your muscle vigorously in any way, you could do that in your job. You create micro tears in the muscle. I mentioned that earlier. What can happen is a larger tear than normal could be created, and that is enough to be considered an injury. that will create scar tissue. Usually hurts for between a week and a month, and generally goes away with little to no mention later in life. Those things accumulate and they stay in your body. Those can be a muscular knot, and they're typically what we complain about. They're areas that we overuse. They are areas that we have injured in the past and didn't take care of properly. And they are probably the number one complaint. Then there are fascial knots. And that's where those typically happen primarily with repetitive use. So what that means is, like typing, you'll be using a lot of this, some in here, mostly this. Mouse hand, click, 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 right here. See that moving? Right there. What can happen is, and again, I don't know how much of this I can say in good conscience, knowing that there may be studies to disprove what I'm going to say. But here's what I've been taught, and I, in my practice, have not experienced anything to discredit this view. When that muscle gets warmed up, then that warms up the fascia around it. And though it's firmer and doesn't move as much, it does move, it does adjust. And so, just like if you wear away at a joystick, if you're a gamer, you'll know this, it doesn't happen overnight. But by golly, if you're playing a fighting game and you're doing this a lot, then you're going to wear away at that joystick pad, and it's going to start either wearing away at the edges, or there's going to be a shift in the surface of the pad. It will be moved to a different area, it will be worn away in a specific area. This is what happens. The fascia gathers up in a spot where there is a lot of movement, repetitive movement, and that forms like a pellet. It forms a knot, a ball of wax, and you have to gradually try to replace it back where it should be. Stretching can help with this, but honestly, repetitive replacing and retraining of the body is the best way to address that. And what they feel like, a muscular knot, you can feel the fibers of the muscle, especially after you start working on it, and it gives a lot quicker. A fascial knot does not give very quickly. You can feel the muscle give inside it and around it, and then you can still feel that tension there. There was one particular time where it's like the fascia encapsulated this particular area of muscle, and so I felt the muscle give on the inside of that hardened or thickened fascia, as well as the outside, but it was still there, it was still tight. Eventually we worked through it and it wasn't a problem anymore, but very fascinating for me. Similar to a muscular knot can be muscle strand tightness, and that can be where a particular strand of muscle is tighter or more used than the rest of the muscle. And that can both happen from injury or repetitive use. So a really good example would be the deltoid. So the shoulder cap muscle. This does this, all of this is from the same muscle right here. So if you say wash windows, you're going to be doing this a lot. You're going to be using this strand of the deltoid. And so you may not feel all that much back here, but it's definitively the same muscle. And certain strands of that muscle will remain tight even after the rest of the musculature around it has relaxed and given way. And I'm actually planning on making a little video for that involving cookie dough. You'll find out later. Don't worry about it. Inflammation. What it feels like. If you have ever had a toy called a water snake, it feels just like that. Inflammation kind of feels like a water balloon underneath the skin. If you press down with your hand and you move, you don't feel the fascia, you don't feel the tension under the skin that you would feel in other parts of the body. And of course, everything is relative. You have to compare to the same body. Same with tension. My tension may be completely different to another person. My tension may feel like the other person's relaxed muscle. It depends on the body. Every body is different. Literally, every body is different. And with that, slippery muscle can be gotten at different stages in the massage. So what slippery muscle is, it's inflammation inside the muscle. It can happen, it either happens, well, it does happen with injury. Major indications of an injury in a body are heat and inflammation. So inflammation is swelling, there's extra fluid, it looks distended, there is visual expansion of the surface. Heat is another indicator. You can run your hand along the surface and right here will be several degrees warmer, and you carry on and it cools off again. And not taking that as like, yes, over here is going to be warmer than over here because I have more blood vessels right here. Being sensible, like here versus here and here. This is warm, that's a point of injury. What can happen is that's a good indicator of if someone has pulled a muscle, but also what can happen in massage is if someone says, yeah, this is just a really tight muscle and it's not letting go, and I've been trying, and then you get into a session and you try really hard and it's still not budging, or it's budging some but it's not completely released. You need to watch out for this, because at the point where it becomes slippery, at the point where there's a lot of fluid on the muscle, and when it starts slipping and becomes hard to pin down, that's a point where you're injuring the muscle and the massage is no longer beneficial. That's the point where you start damaging the muscle, where it starts to need to develop scar tissue in order to repair itself and not just fill in the micro tears with muscle cell. Moving on to things I normally explain in a massage. Something I like to say is that the body is a third party. So some people may think of their body as themselves. which is not true. In any massage room, there are 3 people. There's me, the person on the table, and their body. If someone will be on the table and they'll be twitching, and that's perfectly fine. Some people feel self-conscious about it. Don't be. Some people will be twitching on the table and they'll say, "I'm so sorry. I can't help it. I'm trying to relax." That's because you are separate from your body. Your body has instincts. It wants to protect itself how it wants to protect itself. It has gone through a lifetime of habit making, traumas, injury that has trained it to behave a specific way to outside force. What my job is to do is to approach that body to make it feel like it can trust me. Not you. I have a feeling that you would trust me, and I don't worry about you. Not to be mean about it. I need the body to trust me, because no matter if you trust me implicitly with your life, if your body doesn't feel safe with me, I can't do anything to it. It has to allow me into it. It has to allow me to make change. It has to accept what I'm doing to it. If it doesn't think that what I'm doing is beneficial or in its interest, it will reject what I'm doing, and all of my effort and all of your time will be for nothing. That went a little bit further than I intended. That went into another point. I've adopted a mentality that massage and stretching should be performed within the body's comfort level to yield the best results. And that's why. Something else is I love educating my patients, and the best patients do their best to take care of themselves in their own time. I'm wasting your time if I am doing things that you could have done for yourself. There will always be more for me to do that you're unable to do on your own. I have a few people who come to me and place their health and well-being in my hands. They say, "It's not my body, or not my responsibility to take care of my body. You have it. You are my caretaker. You make me better." That's not okay. You need to be responsible for taking care of your own body. Be responsible for your own health. That's not for anyone to do other than you. I am someone to assist you in maintaining yourself. I'm here to do things you can't. But if you have general muscle tension in your forearms, and you know that that's a problem, and you haven't been stretching, you haven't been doing self-massage, you haven't been thinking about what you can change to benefit your body and to limit the stress that your arms take, then you're wasting your time. You're wasting your money by coming to me to do things that you can do for yourself. And I mean, give and take, because there are people who just definitely won't take that amount of effort to take care of themselves, but then, they're still better off coming to me than not, because if they don't come to me, then they won't receive that kind of care at all. It's just sad, because they could be receiving so much more benefit, and they could be living better lives if they just took the effort to take care of themselves. Off of that soapbox. Let's see. Speaking back to having the body be relaxed and trusting of the worker. The best work to be done to the body is done by an outside source while the body is able to relax. Self-massage and self-care is very good. I absolutely think it's necessary to maintain quality of life. An example I used from school was, if you stub your toe, what are you going to do? You're going to grab it. You're going to compress it. That is body work. That is massage. You do it instinctively. What do you do when you have a stiff neck? You grab it. You do range of motion. You try to get the fluid moving. You try to stretch out the muscle. That is body work. It's instinctive. And I truly believe it's necessary. No matter if you know what you're doing or not, you're doing it sometime. Just more is better. There is only so much benefit you can receive by using muscle to relax muscle. It's counterproductive. Of course, there are ways to do it so that you get more benefit from it, but you're still... There's give and take there. Whereas if you are able to entirely relax, if your body is able to not use any muscle, not use any energy, not have any stress while you're receiving care, that is the most benefit, and that gives the best, longest lasting result. Another point, body work is done superficial to deep. So what that means is from the top layer through to the bottom layer. You remember when I said earlier that you won't... Maybe I didn't say this yet. Never mind. I'll just go on. So you have to get through the top layer before you get to the subsequent layers. It's just like sheets of... Let's just use wax. Sheets of wax. There's several sheets. You have to melt through the first layer until you make contact with the second layer, and you keep going. And sometimes there is just general tension for the first 4 or 5 layers of muscle. Usually you hit some trouble area before then. But sometimes there are layers of muscle that just have general tension, that need pressure, friction, warming up, moving of fluid, relaxation, before you hit a knot or a tight muscle strand or something that needs specific attention. And so people who go into deep tissue work, where they just drop their elbow into someone without doing that general work first, that is like dropping a weight onto those wax sheets. It'll break it, and it's damaging to the tissue. So if you don't feel that you're getting that specific point in your body worked on the first session, or maybe even the first few sessions that you receive massage, it's probably because you just haven't gotten to that point yet. And also along the line of, if your pain is not feeling like it's being addressed, it could be that that's not the area that needs to be addressed. Another point related to that is that where pain is felt is sometimes, and in fact often, not truly where the attention needs to be taken for the body work. A very good, very common example of this is the chest and the upper back shoulder area. These are the pecs, generally, and this is the upper traps. And the chest and the upper back share very intimate relationship, very direct relationship. So they both, your traps attach right here, and your chest attaches right in here, your pecs. Not only your traps, but also your shoulder muscles wrap around and attach at the same point where your chest attaches. So, in modern society, we typically have our arms directly in front of us. We're often working at computers, we're lifting things, hammering, sawing. We have a lot of jobs with our hands in front. This engages our chest to bring our arms in front of us. Anatomical position this is anatomical position. This is where the shoulder should rest. But instead, it's pretty far forward. What can happen is the chest, since it is used passively almost, it's used actively, but because it's maintained in a short position, it grows to stay that way. This regularly, consistently stretches out our back and shoulder muscles. And so that they are trying to pull your shoulder back into anatomical position, back into proper alignment. And they can never do that because you always have to have your hands in front of you. And so we feel all of that tension and stress in our back because they are always working so hard to pull our shoulders back. And they never can. So it's important to work out the chest. By workout, I mean massage, stretch, do self-care for the chest, open up the chest to relieve upper back pain. A lot of desk workers come and say, yeah, my neck and shoulders are killing me. I always work the chest. And they say, oh, I feel like I can sit up taller. I feel like I can breathe better. Yeah, because this was constricting. That also limits your breath. That limits your thoracic spine, the upper back spine. It scrunches it, it pulls it in fetal position. And that's where you get a hunch. Also, like the hunchbacks, for people who are older, who do gardening, things like that, look down all the time. That's also in the front neck, but that's also very much in the chest as well. Guarantee you, any woman who has a hunch in her back, who's leaning forward, they have a tight chest, and they probably won't let anyone touch it. Let people touch your chest, please. And ladies, by chest, I mean here. I'm not talking about boobs. We don't massage boobs. Special certifications are given for breast massage. That's for like breastfeeding mothers or wet nurses, things like that. I don't have that certification. I don't go there. But it's important to think outside the box. Think about relationships in the body. Along this vein, it's important for a person to develop self-awareness and pay attention to pains and aches in one's body. Notice what causes your low back to become stiff. How can that be prevented? What changes can you make to help you perform the task that you need to do, where you use that part of your body and it becomes stiff. How can you do that a different way? Can you do it a different way? One of the biggest things that I see are people bending with their knees and not, or bending with their back and not their knees. I told my friend who went into a warehouse job that if he wants to stay healthy, stick out your butt when you go to pick up a whatever heavy thing. Stick out your butt and bend with your knees. Keep your spine straight. Look up. Keep your chin up, literally. Look to the ceiling. Stick out your butt, bend your knees. Build your back. Make it strong, and you won't have problems. He said he was doing it, and he didn't have problems. So that's one example. It's good to notice things like that for yourself anyway, so that you can keep track of, oh, I've got this event coming up, and in my regular life, if I don't take it easy in gardening, I won't be able to comfortably go hiking or camping this weekend. I need to choose one or the other, or I need to modify one of the activities to allow for the other. Quality of life. That's what this is about. It's important, for me at least, to be able to do everything you can to make sure that you are living to the best of your capability and to be able to enjoy life and do the best you can in it. So I know this was really long. That's all I have to say thus far. All I have to say. I hope this was of use, and I hope I didn't bore you. Thanks for watching to the end if you have. Please leave a comment or ask for a tutorial on either self-care or on massaging and other parts of the body, different concepts, different styles of massage. I'm happy to talk about it all. And if you have suggestions for me not rambling, maybe, give those too. I like critique. Thanks for watching. See you next time.